Hi, Miss Pesci. How are you?
How are you?
Good. My name is Riley, and I'm a nursing student at Oakland University. So today I'm going to be doing an inspection of your hair, skin, and nails, as well as your head, eyes, ears, nose, and throat.
Okay.
So this entire exam takes about 15 minutes or so. I'm just going to wash my hands real quick, and then I just have a few questions for you, if that's okay.
Sure.
Okay. Do you have any history of skin cancer?
No.
And then does anyone in your family have a history of skin cancer?
No.
Do you have a history of any other skin diseases?
No.
And then have you noticed any issues with your hair or nails?
No.
And then currently, do you have any changes in your skin, like rash or itching?
No.
Have you noticed any changes in your hair, like the texture or the thinness of it?
No.
Or any changes in your nails, like the shape or the texture of those?
No.
Okay. And then, do you have any ear pain?
No.
And dizziness?
No.
Any headaches?
Mm-mm.
Any neck pain?
No.
Nasal discharge?
No.
And then any vision changes?
No.
Okay. And then when was your last eye exam?
About 6 months ago.
Okay. Do you wear contacts or glasses?
Contacts.
Are they just like the one-time use or reusable?
Well, one-time use, dailies.
Okay. And then do you have any hearing problems?
No.
All right. So now I just have a few more questions. Do you know who is president currently?
Yes, Trump.
And then do you know what day it is?
October 7th.
And do you know where you're at right now?
Yes, I'm at the hospital.
And do you know? Okay. And then do you know what time it is?
It is 8 p.m.
Okay. So you got all four of those right, which means that you are alert and oriented times 4, which is what we want to see.
Good.
And now I'm just going to do an overall look. So you are 39 years old?
Correct, yes.
And then what gender do you identify as?
Female.
Okay. So just looking at you generally, all of your skin seems to be an even color. You don't have any lesions on here. I don't see any abnormalities, any moles of concern. You are a fair skin tone with pink undertones. And then I'm just going to do a temperature check with the back of my hands on both sides. And you are an even temperature. Your skin is dry and soft.
Okay.
And your facial expressions seem to be relaxed. Your speech is good and clear. You're dressed appropriately for the occasion, and you are well-groomed and hygienic. So the general part is done. Now I'm just going to focus specifically on your head. So I don't see any bumps or lesions on the outside. It looks to be in line with your body. It's symmetrical. Your shape is normal cephalic, which is what we want.
Okay.
And then if it's okay, I'm just going to touch your hair here.
Sure.
And then I'm going to take it out. There you go. I'm just going through here. Your scalp doesn't have any lesions on it. It is all the same color. Your hair seems to be well distributed. I don't see any areas of thinness or any patching. It is dark brown in color with some color treatment on the ends. The texture is good. It is healthy. I don't see any brittleness. All right. So I'm all set with that. You can put your hair back up if you want. So looking at your face now, it is symmetrical. All of your skin is an even color. You do have some light macules on your nose and cheeks, which is just freckles.
Okay.
I don't see any wrinkles. I don't see any sun damage on it. It looks to be healthy.
Good.
All right, so now moving on to your eyes. So they are aligned in your sockets evenly. They are symmetrical on both sides of your face. Your sclera are white, and your eyelashes come out and up on both. They are evenly distributed. I don't see any areas of sparseness. Now I'm just going to put some gloves on to check your conjunctiva. And I'm just going to pull down on the base of your eyelid here, so go ahead and look up for me. Alright, both are pink, your eyes are well hydrated, your eyebrows are even, don't see any patchiness on there, they're evenly distributed as well. So now we will be looking at your ears. Thank you. So they are even on both sides, they're both the same shape, they're a good shape. I don't see any discharge. Do you have any ear pain?
No.
Okay. So I'm just going to go ahead and touch them here if that's okay.
Sure.
Okay, so I am just starting at the top here, the pinna, moving down to the tragus. Does any of this feel tender?
No.
Okay, so they look to be good. And now moving on to your nose. So do you get nosebleeds often?
No.
And do you get colds often?
No.
And have you noticed any nasal discharge
No.
lately? Okay. So it is in line with your face, right down the center. Both sides are symmetrical. I don't see any discharge. We're going to check your nasal patency. I also don't see any lesions, so that's good. So I'm going to have you take your finger and plug one side and breathe in. You can breathe out. Was that good?
Yes.
So you could breathe well?
Yes.
All right, and then I'm going to have you do the other side. They're both the same?
Yep.
Okay, good. Now we will be moving on to your mouth. Do you have any sores in your mouth or anything that's bothering you?
No.
Do you have any trouble swallowing?
No.
Okay, so just looking at your lips here, there's no lesions. I don't see any cracks on the edge. Everything seems to be good. So I'm going to take this right here and I'll use it to be touching your mouth.
Okay.
So I'm just going to put this in between your lips here so you can go ahead and keep your mouth closed. I'm just going to use this to look at your gums in the front. All right, so they are pink. They're not pale, they're not red. And then you can go ahead and open your mouth for me. And then look slightly up. So your teeth are all white. They are all lined up nicely. You don't seem to be missing any. I don't see any dental caries. Don't see any receding of the gum line. Your buccal mucosa on the sides of your cheeks are all pink. There's no lesions on here. And go ahead and stick your tongue out for me. All right, and then go ahead and flip it up as well. Okay, so that's all a pink color. It's all hydrated. You don't have any lesions on there. Good. And then I'll take these off and wash my hands again. So next, we're going to be moving on to your neck. Okay. So do you have any neck pain?
No.
Any limits in your range of motion?
No.
And then have you noticed any swelling around your neck?
No.
Okay, good. So we'll just look here. Your trachea is midline with your body. It is symmetrical on both sides. There's no lesions or anything on your skin. There's no visible swelling here. And then I'm just going to palpate your lymph nodes, starting with the pre-auricular and then moving back to the post-auricular. And then the submandibular here and the submental. And then anterior cervical and posterior cervical. Okay, did you feel any pain when I was touching anywhere?
No.
Okay, and I did not feel any of your lymph nodes, so they are not swollen. And now we're going to check your range of motion.
Okay.
So go ahead and touch your chin to your chest. Okay, and then you can go ahead and put it back and then tilt it as far back. Okay, and then I'm going to have you look to your shoulder on one side, right, and then the other side. And then touch your right ear to your right shoulder and then do the same on the left. Okay, so you do have complete range of motion. And then now we will be checking your skin tartar. So I'm just going to pinch a piece right above your clavicle here. And that is good. There's no skin tenting. And then lastly, we will be looking at your nails. Okay, so your nails are white in color. Your nail beds are pink. The texture is good. The shape is good. I don't see any problems. Checking your profile sign, which is the angle from your nail coming out of your finger. It looks to be about 160 degrees, which is what we want to see. And now I'm going to check your capillary refill. So I'm going to press on here. And then if it refills in 2 to 3 seconds, you have adequate blood flow. And then I'll try this finger too. Good, they both returned in less than 3 seconds. So I'm all done with your examination. Do you have any questions for me?
No, ma'am.
All right, perfect. Well, thank you for your time today. So
Thank you.
if you have any questions, you can give us a call. But
Okay.
if not, then I will see you later.
All right, thank you.
You're welcome.